Welcome to the University of Michigan Dentistry Podcast Series, promoting oral health care worldwide.
When I'm having a hard time brushing Carol's teeth, sometimes I don't know whether something is wrong with Carol or something is wrong with me.
Doug does exactly what the rest of the members of the family do. There's no reason for him not to brush his teeth because of his handicap.
Home dental care for children with handicaps, children and young adults with mental impairments. These children and young adults are smiling and enjoy the physical and social advantages of a clean and healthy mouth. Although youngsters with mental impairments or mental retardation may require more attention to home dental care, their mouths can be just as clean and healthy as any other person. Your child can have a healthy smile that will last a lifetime. Good dental health begins with toothbrushing. Toothbrushing removes sticky food and plaque which contribute to tooth decay and gum disease. Make sure you brush every surface of every tooth. Your main goal should be daily removal of plaque without injuring teeth or gums. A model toothbrushing method is shown in videotape number 2 of this series and can be adapted according to the needs and capabilities of your child. In learning how to care for your child's teeth, it might be helpful in the beginning to practice on another adult and then have that person practice on you. Chris, a supervisor at a group home, relates her experience.
The best experience that I ever had during the training that I took part in was when I had another staff brush my teeth, and I in turn brushed theirs. And we could discuss what it felt like, and that was extremely important.
When providing daily oral hygiene, you as the parent can play one of 3 roles. First, you can act as the provider, being totally responsible for brushing and flossing. This is done when the child is very young or more seriously disabled. Second, you can act as the helper, in which case both the parent and the child are responsible for some part of the procedure. You can assume this role if and when the child can be trained to use his or her limbs more effectively. And third, you can act as the supervisor. Here, the child who is older and has gained dexterity assumes responsibility for cleaning his or her teeth, while you oversee and check the process. Your goal is to have the child do as much as possible for himself. The role that you play depends on how fast the child learns and how much help the youngster needs. The role changes as the child grows. A commitment to good oral care at home is critical since many children with mental impairments have a greater likelihood of developing dental diseases than other children. Weak muscle control, poorly formed teeth or jaws, and susceptibility to disease can contribute to dental problems. Some handicapped children have unhealthy mouths because they have poor diets or because their teeth are just too difficult to clean. However, if you provide good oral care at home, problems like toothaches, missing teeth, bad breath, and decay can be avoided. In many instances, children with mental impairments have the capability to brush their own teeth, but they've learned incorrect procedures which can harm their teeth and gums. Some toothbrushing problems you can look for and correct are: your child continuously brushes on one side only. Your child's mouth is closed when toothbrushing occurs. There is an irregular pattern, skipping from side to side, and excessive twisting and turning of the toothbrush. These problems can be corrected by teaching the model toothbrushing method. If you're still unsure of the toothbrushing method to use and what to do about incorrect brushing, consult your dentist or hygienist. The parents you're about to see will discuss how they provide home dental care for their children. Doug is 10 years old and is generally developmentally delayed. His parents act as supervisors since he is able to complete toothbrushing independently.
We started brushing Doug's teeth when he was about 2 years old, regularly. And we really didn't have any problems other than the fact that he ate the toothpaste and chewed on the brush, but he was always willing to brush his teeth, and then he eventually took it over himself. We generally brush teeth in the morning when we get up and at night when we go to bed. If they've had a lot of sweets during the day, then we encourage brushing right after. It's much easier now for Doug to brush his teeth because he does it with his two siblings, and I think he kind of models after them, and they all just brush their teeth together.
Children with more severe mental impairments also can assume responsibility for toothbrushing and flossing. Carla's parents play the role of helpers.
Carla is 18 years of age. She is severely mentally impaired, and she has been classified as spastic with problems in the area of fine motor coordination. Carla was about 2 years of age when I first started brushing her teeth. She didn't like it at first, and we've been working on it ever since. We kept experimenting, and we finally found a toothpaste that didn't irritate her gums, and she liked it. But we had pictures that we received from the dentist and put them right above the sink where I was to brush her teeth. And we would sing little songs that we had heard, and we looked at pictures in magazines that looked really nice about brushing teeth, that sort of make it a fun thing rather than a real chore. I brush Carla's teeth in the bathroom most times, but occasionally if the bathroom is sort of jammed up, I'll bring her downstairs and we brush in the dining room at the table. Carla does not like to be flossed, so it's quite a procedure, but I stick with it knowing that the end results is going to be good.
Carol's parents are attempting to play the role of provider and are totally responsible for brushing Carol's teeth. However, since she has some severe behavior problems in addition to her retardation, it is difficult for her parents to do this.
Carol is a severely mentally impaired child. Her behavior pattern is kind of unbearable sometimes, and it's kind of hard to deal with her, but we love Carol, and we try to help her every way we can. When I try to brush Carol's teeth, it's a lot of fun. I have to chase her all over the house, and then when I catch her and get her back into the bathroom, I try putting the toothbrush in her hand, and then she brushes her face and everything but her teeth. She won't brush her teeth with a toothbrush.
We started trying to brush Carol's teeth when she was about 3 years old. She didn't like it. She didn't like the taste of toothpaste. She didn't like the brush or anything. She would really cry, you know, so I let it go for a few years, and then we tried up again. I see improvement because, you know, before she wouldn't even hold the toothbrush. Now she'll hold it. Even though she smears it all over her face, it is progress to us because she would not touch a toothbrush and ran from it before. I believe, you know, with us helping at home and with the school, this is the reason now she'll try to, you know, do something with the toothbrush. I believe the best results are when we're working at home and they're working at school.
Mark particularly has a hard time with toothbrushing. He's not real keen on opening his mouth. For some reason, it seems to frighten him. But he's gotten better since he came here. If you go at it kind of slow and do it for a brief period of time, he's much better than if you try to prolong it. At first, he would refuse to brush his teeth, but now at least he'll open his mouth and let us work with him a bit. Matt doesn't seem to have too much problem with it. He kind of likes it. He likes the taste. And for the most part, he doesn't give us any problem.
Effective toothbrushing and regular checkups are important for your child's oral health, but so are good eating habits. A nutritionist talks about this.
Parents can help build good teeth and gums by providing 3 healthy, nutritious meals based on the basic 4 food groups, by providing healthy snacks, and by providing at least 4 glasses of fluoridated water per day.
The daily food guide consists of the milk group, the meat group, fruits and vegetables, and the grain group. You should avoid foods that are high in sugar content. That stick to the teeth are those that don't dissolve easily because such foods produce acid that causes tooth decay. Many commercially prepared foods contain a lot of sugar. So it's important to read labels and choose food with little or no sugar added. Allergies may also be a problem, and parents may need to work with physicians and nutritionists to find adequate food substitutes or supplements. Though severe difficulties in sucking and swallowing may have required tube feedings or foods that must be liquefied, you should consider progressing to more solid foods as soon as possible so that the muscles of the mouth and jaw are exercised.
Snacks, as a rule, should be limited or eliminated. If a snack is needed, I'd rather see a snack like a toasted half a muffin with cheese, a good protein food that's going to contribute more valuable food factors to the growing child.
Carla gets snacks usually when she comes in from school, and most times it's peanut butter and crackers or peanut butter and bread. Sometimes we might have homemade vegetable soup for Carla, but we try to stay away from the sweet foods.
We used to give her a lot of candy and stuff because we found that was the only way we could make her do something. But after that, you know, if you just give a child candy all the time, that's all they want. So we started getting a lot of fruit. And we give her fruit now, and she loves it. When Carol has too many sweets, she gets all hyped up.
All children like candy and like sweets and cookies, but we've, from early on, tried to get them to minimize that.
You can effectively control foods that your children eat at home. But what about when they're away from home? You can try to control these situations by providing nutritious snacks for school parties or other occasions.
Carla was getting some candy and sweets at school, but I recommended that they weren't good for her teeth or her weight control, so it was stopped.
The best results occur when parents and school personnel work together on nutrition and daily oral care. Sometimes schools offer special health programs which are extremely useful.
I'm the nurse at Detroit Northwest Center, which is a school for severely mentally impaired and multiply handicapped children. Three major areas of concern that we have with our children here are foul breath, food residue around the teeth, and a lack of adequate dental care. Any type of offensive odor makes you want to leave the area or the person. You're not as close with them as you would like to be. And in dealing with this, whoever, whether it's the classroom staff or the classroom children, it's something that needs to be addressed. Now, these things can be handled by the parent very simply. One of the things that can be done is after a child has his meal, his mouth can be rinsed with water. He can have a nice long drink of water, and that will help with getting the food out of his mouth, plus help with cleaning his teeth and with his breath. Also, if the child is able to chew things like apples, carrots, any hard, crunchy food, that can be packed in their lunch. So along with them, and when they finish their lunch, they can finish off with this hard food, and that will help clean the teeth.
Combined with your work at home and school, the dentist plays an important role in maintaining your child's dental health. Regular checkups are advised once or twice a year.
First thing that we'd want to do is to secure a very adequate health history, including the medical, the dental, and the behavioral characteristics of the child as far as they're known.
How much will your child understand when the dentist explains or shows something? Can your child sit in the dental chair without help? How much control does your child have of the mouth, head, and neck? How do you get the child to cooperate? You may have difficulty finding the right dentist for your child. Some dentists are uncomfortable about working with a person with a handicap. Sometimes the youngster's physical or behavioral problems present such difficulties to a particular dentist that he or she cannot work effectively with the child. You may find it necessary to try out several different dentists until you find one that meets your child's needs.
Her behavior, she doesn't like uniforms and doctors. So she goes through her tantrum, and so the doctors, they're afraid of her. So, I mean, I believe that she would have to be sedated or something in order to get the work done on her teeth.
I think that if we don't find a dentist for Carol, all of her teeth will probably get rotten, and we'll have to get them all pulled.
At first, it was difficult to find a dentist for Carla, but I called the Detroit Association for Retarded Children, and they referred me to a dentist. And also, anyone can call their local association for retarded children, and they can get the same types of information.
You may be afraid of visits to the dentist office because you're not sure of how your child will behave there or how others will react to your youngster. Therefore, you'll need to arrange office visits so that your child will be the most cooperative.
As you come into the office, please do not be embarrassed in relation to other families who may be waiting. We, in our office, intend to see the handicapped child on regular appointments, just like we do all the other patients who come to our office. We in the dental profession are here to help you, the parent of the handicapped child, the best way possible, presumably with the emphasis on prevention rather than on treatment.
One of the ways a dentist can be helpful is in the management of medication. You should ask about the possible side effects of all medications that are prescribed for your child, since some medications affect the condition of the mouth, gums, and teeth.
We have several residents that are on some sorts of medication, particularly seizure control drugs, and some of them do cause a lot of the bleeding gums and so forth. So we have to be extremely careful using the softer brushes, using a very, very soft technique.
When Doug was 4 years old, he had to have a gingivectomy, which meant he had to have his gums cut back, upper and lower, to allow his teeth to protrude through his gums so he could eat and chew his food properly. His gums had become this way since he had been put on Dilantin, a medication to control his seizures. Now, sometimes doctors who care for seizures won't worry about this, and sometimes doctors who care for teeth cannot order these medications that control seizures. So it's very important that the parents make sure both doctors know what's going on.
Often, though, gum disease can be controlled, even with a lifetime use of medicines such as Dilantin. Daily brushing, flossing, and massaging can reduce the likelihood of this problem. Frequent rinsing with water is also advised. Sometimes parents and their children need specialized training in order to provide effective home dental care. The assistance of an occupational therapist can be important.
The role of the occupational therapist is to promote independence for the child so that they can be as independent as possible and do things on their own. We try to achieve this through normalization of muscle tone, the use of adaptive equipment, and several other devices and techniques. The occupational therapist anticipates having a long-term relationship with the family, starting when a child is very young, working up through adolescence and adulthood. Probably some of the most specific problems that we would see would be a problem with sensitization, the child not liking his face or oral motor area touched, and we can work on improving that.
Adaptive devices, including electric toothbrushes and water picks, can be useful for children or adolescents who have physical problems, such as limited grasp or limited range of motion. These should be used with the advice of your occupational therapist, dentist, or hygienist. Brushing your child's teeth can sometimes be made easier by varying the position you use. Holding your child in a firm yet gentle manner provides support and comfort, especially when there are uncontrolled movements. If your child is large, somewhat uncooperative, or has excessive head movements, then seat her in a chair and stand behind her. Use one arm to cradle and support her head. If your child is uncooperative or needs support for his arms and legs, then seat him on the floor with his back to the chair. Sit in the chair and cross your legs over the youngster's shoulders. If your child is very young or in bed for a period of time, position him on the floor, bed or couch, then lean across him or stand by his head. If your child is young or moderately disabled, then place him on a couch with his head on your lap. If your child is particularly uncooperative, then you may need two people. As your child learns to accept home dental care, the need for such restraint will disappear. Being the parent of a handicapped child, you have many responsibilities concerning health care. Some of your child's problems are difficult to solve. However, good oral care at home is one area in which you can make an important impact. This can mean fewer medical and dental bills, a more pleasant appearance, fewer chewing and speech problems, and greater social acceptance.
It's definitely a chore. It's hard. It's not fun, but it is definitely worth the time and the trouble to brush their teeth.
I get very tired, very angry, and I don't know what to do. I tell a parent, if they got, like I am, almost crazy, you gotta keep trying, because they need us, they need our help.
Brushing Carla's teeth is quite a job, but I know that it's necessary, and I've helped her to accept the fact that brushing teeth is good. And sometimes you want to give up, but you know that you can't, so you just hang in there. And that's what I've done, just stuck it out.
These parents are working hard to provide good home dental care for their children. They're getting results. So can you. Remember, brush your child's teeth at least once a day, preferably at night. Provide fluoride either in the drinking water or through supplements. Visit the dentist regularly, approximately once every 6 months. And avoid sweets. Your child can have a healthy smile that will last a lifetime.
When you're smiling, the whole world smiles with you. When you're laughing, the sun comes shining through. But when you're crying, you bring on the rain. So stop your sighing, be happy again. Keep on smiling, 'cause when you're smiling, the whole world smiles with you. But when you're crying, you bring on the rain. So stop your sighing, be happy again. Keep on smiling, 'cause when you're smiling, the whole world smiles with you.
You've been listening to a presentation from the University of Michigan School of Dentistry, which is dedicated to supporting open learning and open educational resources. This recording is licensed under the Creative Commons. It may be reused and redistributed for nonprofit use. Please attribute materials to the University of Michigan School of Dentistry and redistribute under this same license. For more information on how this and other University of Michigan School of Dentistry recordings may be used, visit www.dent.umich.edu/license.